is going to talk about a specific program that uses technology with children to help them become more healthy.
Forward.
Down.
Down. These are all loaded together. Keep going down. And then when I want to advance it down?
Yep.
Okay, sorry. Well, thank you. Thank you. First, I'm very delighted to be here and to see so many individuals from different disciplines in this audience, including nurses and others who are really important in this obesity epidemic. I have been asked to talk about a little bit about exergaming and about a specific program, Go Kids Boston, which is housed at the UMass Boston campus. But I must add, I just came literally from the American Heart Association, and I must add that childhood obesity was front and center there in terms of looking at childhood obesity as a major risk factor for adult cardiovascular disease. So, down again. So some themes run consistent with Dr. Sachek and Dr. Geller had mentioned. And we've come to look at, or we understand with accumulated data, that obesity results from an interaction of genetic and potentially modifiable behaviors and multi-level environments. And we know that any efforts to reduce, to prevent, and or manage obesity really need to be directed beyond the level of the individual. We know that individual behavior matters, that obesity is a result of an imbalance between energy intake and energy expenditure, which takes us to patterns of physical activity and dietary behaviors, which in turn are influenced by a variety of contexts or systems across the life course. So for example, a school-age child is influenced by the family as well as the school environment, and in turn that school environment is influenced by policies that affect the food and physical activity environment of the school. So we are all on the same philosophical page here, or perspective. So we know that physical activity has many health benefits. Accumulated data in adults has demonstrated that. I included this slide, which was adapted from Trost and Luprisi from the Journal of Clinical Lipidology. And we can see that in children, we know that vigorous sustained activity positively influences cardiorespiratory fitness, psychological health, improved self-esteem, self-efficacy, skeletal health, adiposity. The data are somewhat mixed on blood lipids and blood pressure, but the point is that we need more specific data on the duration, dose, and intensity. But we know that physical activity does have a positive impact overall. So that it is important when we look at this in the context of the social ecological model, we think about how can we, or in what environments could we impact to influence physical activity in children. Okay, so we know we have evidence-based recommendations. First ones were issued by Strong et al. In Journal of Pediatrics based on accumulated data that 60 minutes or more of moderate to vigorous physical activity was recommended. And MVPA really requires an energy expenditure of at least 4 metabolic equivalents. One is equal to 1 metabolic equivalent is the energy costs associated with sitting quietly, or 40 to 60% of maximum oxygen uptake. And this 60 minutes per day can be achieved through intermittent physical activity, 10 minutes, 10 minutes, 20 minutes. From a cardiovascular standpoint, data suggests they should be accrued at least 10 minutes at a time. Then we had the 2008 Physical Activity Guidelines for America, which reaffirmed that and also added muscle strengthening and bone strengthening. And so we have on this slide a number of different types of activities, including the aerobic exercise, which we're very familiar with. A level of intensity, 3 to 6, is considered moderate, greater than 6, vigorous, and that would expend about 7 calories per minute. And we also recommend muscle strengthening, pulling muscles to work, called overload weightlifting resistance bands, and bolt strengthening, which produces a force in the bones to promote growth and strength. Running, jumping, rope, jump rope, tennis, basketball, hopscotch are all examples of that. And we also know, as Dr. Jennifer Sachek mentioned, we have both data from Massachusetts and nationally that suggests that there are declines in physical activity, particularly as children move from the school age years to adolescence, more precipitous in females. So we look for alternative ways to increase physical activity in children and adolescents. And I might add that this is just one example, exergaming. I think that there are different mods that apply in different settings. So enter Go Kids Boston with the empowering theme. That has also been mentioned earlier, and it is a center for empowering kids to become healthy adults. Talk a little bit more about that. We have research, training, and community outreach in the center. We'll speak a little bit more about research briefly. We have training for our exercise and health science students and for our nursing students as well in terms of physical fitness, assessment of adiposity. We have a full-scale center in terms of many measures to capture adiposity, including bioelectrical impedance and DEXA, which are run by trained individuals. And we have a variety of community outreach projects where we try to bring children from the Boston Public Schools, from the diverse income communities of Boston, to the center where they have a safe place to learn about how to be physically active, fit, nutrition, and wellness. And I might add, sitting in the back of the room, Megan Sametsu, who has been a very key part of our Go Kids Boston, whose mother is here. She was in exercise science and now is in nursing. So, had to add that. And very energetic, innovative, and passionate about physical activity and wellness. I've listed here, we don't have this listed on your slide, but Go Kids Boston was founded in 2007. I joined the faculty there as the first Associate Dean for Research just that year. But this is a collaborative effort between two visionaries at UMass Boston Children's Hospital Boston. At its inception, Greer Glazer, who's the Dean of the College of Nursing and Health Sciences with PI, Jean Viescia, is now our director, and she is in the Department of Exercise Science. Brings a community-based perspective and with strong emphasis on nutrition. I'm the research director, and Brianna Ford is the program coordinator, with Carlos Salas being the exercise physiologist. We also have a board of advisors, and I won't list all their names. So what is exergaming, and why is it appealing? Exergaming, I've given a definition here, provides an innovative, interactive, technology-mediated, and should be developmentally appropriate way to engage and promote physical activity and fitness in children and adolescents. I've listed some of them here: sports, wall, tracer, and other games. So let's take a quick look at what we offer at Go Kids Boston and what these are, and I've given you the website and another site. We have a number of treadmills. We have sport wall there to the right, which all of these combine technology and physical activity, and we know our kids are high-tech, soft-touch, high-tech, can really engage in and enjoy this kind of interaction. And here's children, the last slide is children who are happy after and engaged after participating in Go Kids programs. And here we have an example of resistance training with our one of our exercise folks, our interns. And back there is Tracer. These are interactive opportunities for children to engage in physical activity. And these are the exercise bikes, which can increase from moderate to vigorous physical activity, and they have programs. I'm sure many of you in the audience are familiar with these. All right, so that we have minimal data, though, to date on how much energy is really expended in this. So one study that was recently published in Pediatrics, it was designed to combine and compare rates of energy expenditure and other variables while children were playing two physically active video games, Dance Dance Revolution, which is one of the, somebody who knows it in the audience. It's one of our favorite, the children's favorite, adolescents' favorite, and Nintendo Wii Sports in relationship to treadmill walking. And bottom line is that both games elicited energy expenditure, heart rate, and ventilatory responses greater than or equal to moderately intense walking. Energy expenditure 3 times greater than resting, which is very informative to know. I might add, as a researcher, there was one little slight typo. The participants in this study, there were 23, small study, 61% female, 10 to 13 years of age. Their BMI overall was 19.1 with a standard deviation of 3.1, and the mean BMI percentile, means where they are relative on the CDC age and sex specific growth charts, was 54 with a standard deviation of 31. So this was an idiosyncratic sample in terms of not being, in terms of their obesity prevalence. So at Go Kids Boston, we have a variety of research programs designed to, one, measure physical activity and energy expenditure from these interactive technologies, and a variety of programs focused on prevention and management of overweight and obesity in children, adolescents, and families, including Jessica Whiteley's study, for which Megan is the program coordinator, using internet-based intervention with overweight minority children, and another study, which we will share in one moment, focused on, that combines clinical and population-based approaches. I've listed the website here. It's not on your hard copy, but I would encourage you to go on there because you will see the video games active, the children engaged, and the programs that we actually have there. So we really combine UMass Boston, Boston Public Schools, Go Kids, and Children's Hospital Boston. And most recently, Sarah DiFerrani, who was head of preventive cardiology at Children's, and I and a group of collaborators at UMass Boston and Children were funded through the Harvard Catalyst Fund to look at to really test the effects of participating in Go Kids on a number of variables, including moderate to vigorous physical activity, CVD risk factors, fitness, and self-efficacy. And in a sub-study, we will look at a number of other markers. I've included here some resources that I hope you will look toward, and I leave you with that thought. We'll be happy to participate in a panel discussion or answer any questions you might have. Thank you.
Thank you. I have to say I've been to the Go Kids Center, and if any of you are really interested in taking a look at this, it's a very exciting place and a really promising approach, I think, particularly for inner city kids.